At Carepatron, we are constantly looking at ways to improve. If you have any feedback for our content or videos, please leave us a comment in the comment section below. Systematic desensitization is a type of exposure therapy used to treat anxiety disorders and phobias. It's a structured, gradual approach that helps patients confront their fears in a safe and controlled environment. This therapy works by pairing relaxation techniques with graded exposure to progressively more fear-provoking stimuli related to the patient's anxiety. Through repeated exposure and relaxation, the patient learns to manage their anxiety response and eventually overcome their fear. Here are some aspects of systematic desensitization. Relaxation techniques. Patients learn techniques like deep breathing, progressive muscle relaxation, or mindfulness meditation. Fear hierarchy. A collaborative effort between therapist and patient creates a list ranking the patient's fear triggers. Gradual exposure. The patient is gradually exposed to their fear triggers on the hierarchy, beginning with the least arousing scenarios. Systematic desensitization offers a structured and evidence-based approach to managing anxiety and phobias. Building on the foundation of understanding the exposure hierarchy of classical conditioning and relaxation techniques, let's explore the step-by-step process of systematic desensitization. Collaboration and assessment. The therapists collaborate with the patient to identify the specific phobia or anxiety-provoking situation. Here's what this step might look like in practice. Identifying the fear. The therapist might ask the patient about the specific object or situation that triggers their anxiety. Building the hierarchy. Together they brainstorm and rank various situations related to heights, starting with the least anxiety-provoking and progressing to more fear-inducing scenarios. Learning relaxation techniques. The therapist equips the patient with relaxation techniques to manage their anxiety during exposure. These techniques may include deep breathing, progressive muscle relaxation, and guided imagery. Gradual exposure and response prevention. Now the actual exposure therapy begins. The therapist starts with the lowest item on the graduated exposure therapy hierarchy. Here's how it might unfold. Imaginal exposure. In the initial stages, exposure might involve imagining the least fear-provoking scenario while practicing relaxation techniques. In vivo exposure. Once patients feel comfortable with imagined exposure, they can progress to real-life situations. An essential aspect of this step is preventing the avoidance behaviors that typically reinforce anxiety. The therapist encourages the same relaxation, training the patient to tolerate some levels of anxiety during exposure without resorting to escape or avoidance strategies. Reinforcement and progress monitoring. The therapist provides positive reinforcement and encouragement throughout the exposure process, as the patient successfully manages their anxiety at each level of the anxiety hierarchy above. To learn more about systematic desensitization, go to our Carepatron website or click on the link in the description. We have a range of guides and articles to help you learn more about different therapy techniques to incorporate into your practice. Carepatron is a healthcare platform designed for you. Signing up is free, just click on the link in the description. If you enjoyed this video, don't forget to hit the like and subscribe button for more content like this.